concept of equity and inequality can be confusing, especially since they are often interchangeable. A population approach to health inequalities assumes that vulnerable and marginalised groups are similarly disadvantaged. It proposes that providing those at the high-end risk of population with access to the same health resources as everyone else will reduce the inequalities and benefit health. However, we know that this is not true. This approach doesn't take into consideration the differences in needs and even exacerbates the distribution of inequalities in the society. Yet, there are strong links between the accumulative effect of systematic disadvantage and discrimination and poor physical and mental health. Even more, in reality, it is the intersection of numerous factors such as gender, age, religion, class, the combination of which will differ amongst the individuals. That influences chances of people having a healthy life, including their access to services. An equity approach instead stands for the fair and just distribution of resources according to the needs, so that everyone has an equal chance at a fulfilling, healthy life.
The alphabet of health inequalities was conceived and designed in the true spirit of co-production, with respect, inclusivity, tolerance, and equity at the core of our work. By public advisors and researchers of the NIHR Clark Northwest Coast, now ARC Northwest Coast, we took the time necessary to develop the A to Z cards and attach booklets as tools that can facilitate conversations with researchers, practitioners, funders, and members of the public about the diverse range of issues that impact and contribute to health inequities. The cards came about following a couple of years of work by the Clark Northwest Coast Health Inequalities Group. We had a long debate about which were the best words to use, and even if we should use more than one per letter. So these are not a definitive list, but rather suggestions designed to get people to think about the causes of health inequalities and equity. Often, when we think about health, the first thing that comes to mind are hospitals or doctors, or maybe behaviours like what we choose to eat or whether we exercise, smoke, or drink alcohol. However, in addition to demographics and lifestyle choices, social, economic, physical, political factors like a good home, good education, a decent job, friendships, and social networks are equally key to a healthy life. These are often referred to as the social determinants of health or the causes of the causes.